Cirrhosis of the liver is a significant health condition that demands our attention. It represents an advanced stage of liver damage, where healthy liver tissue is replaced by scar tissue. This process, known as fibrosis, is the result of long-term, persistent injury to the liver. Various diseases and chronic conditions can inflict this damage over many months or even years. The fundamental problem in cirrhosis is the extensive formation of scar tissue. Unlike healthy liver cells, scar tissue cannot perform the liver's crucial functions. As more scar tissue forms, it disrupts the liver's structure and blood flow. The liver is responsible for over 500 vital functions that keep us alive and healthy. When cirrhosis sets in, this intricate machinery begins to fail. The scar tissue acts like a roadblock, impeding the liver's normal operations. This impairment means toxins can accumulate in the blood, and the body might struggle to get the nutrients it needs. Understanding cirrhosis is about comprehending a process that can deeply affect your overall health and quality of life. One of the most insidious aspects of cirrhosis is its often silent progression. Many individuals may live with developing cirrhosis for years without noticeable symptoms. The liver is a resilient organ, capable of functioning even when partially damaged. This resilience can mask the underlying disease process. As scar tissue accumulates, the liver compensates, and the person may remain unaware of the growing problem. This silent nature makes cirrhosis a hidden threat, advancing until significant damage has occurred. The lack of early warning signs means cirrhosis is frequently diagnosed at a more advanced stage. Understanding this characteristic highlights the need for proactive approaches to liver health. Knowledge empowers individuals to be vigilant about their liver health, even in the absence of symptoms. Early awareness transforms the narrative from reactive treatment to proactive prevention and management. A common belief is that cirrhosis is solely a consequence of long-term, heavy alcohol consumption. While alcohol abuse is a significant cause, it is far from the only culprit. Conditions like viral hepatitis and fatty liver disease can also lead to serious liver damage. Chronic viral infections, such as hepatitis B and C, are major global contributors to cirrhosis. The rising epidemic of obesity and type 2 diabetes has brought non-alcoholic fatty liver disease, NAFLD, to the forefront. In NAFLD, fat accumulation in the liver can trigger inflammation and damage, progressing to cirrhosis. Other causes include autoimmune diseases, genetic conditions, certain medications, and prolonged exposure to toxins. Understanding this wide array of potential causes is crucial for prevention and early detection. This broader understanding helps in identifying at-risk individuals and encourages a more inclusive approach to screening and education. The development of cirrhosis is not a sudden event. It is the tragic endpoint of sustained liver injury. Various factors can initiate and perpetuate this damaging process. Chronic excessive alcohol consumption is a well-known path to cirrhosis. When you drink alcohol, your liver works hard to process it. This metabolic process produces highly toxic byproducts, like acetaldehyde. These substances can directly damage liver cells, causing inflammation. If drinking continues, this inflammation becomes chronic and persistent. The liver's constant attempts to repair itself lead to scar tissue formation. Over time, this relentless cycle of damage and scarring results in cirrhosis. Viral infections, particularly chronic hepatitis B and C, are major global drivers. These viruses establish a long-term infection within the liver cells. The body's immune system tries to fight off the infection, creating persistent inflammation. This chronic inflammation, slowly but surely, damages healthy liver cells. Non-alcoholic fatty liver disease, or NAFLD, is rapidly becoming a common cause. This condition is often linked to obesity, type 2 diabetes, and high cholesterol. In NAFLD, excess fat builds up inside liver cells, causing inflammation and injury. The liver's response is to form scar tissue, leading to fibrosis and eventually cirrhosis. Section 2. Listening to your body. Recognizing the spectrum of symptoms. A significant problem with cirrhosis is its often subtle onset. In the early stages of liver damage, many people feel perfectly fine. The liver has a large reserve capacity and can function despite initial scarring. This means symptoms may be absent or incredibly mild for a long time. This silence can be dangerous, as the disease can progress unnoticed. It delays diagnosis and the opportunity for crucial early interventions. Therefore, recognizing even slight changes can be very important. When early symptoms do appear, they are often quite general. You might experience persistent fatigue that doesn't improve with rest. A general feeling of weakness, or being unwell, or malaise is also common. Some people notice a loss of appetite or unexplained weight loss. Nausea, sometimes accompanied by vomiting, can occur. You might also feel a dull ache or discomfort in the upper right abdomen. These symptoms are nonspecific and can easily be mistaken for other issues. However, if they persist, it's important to consult a healthcare provider. As cirrhosis progresses and liver function significantly declines, symptoms become more obvious. Recognizing these signs is crucial for seeking timely medical attention. Section 3. The ripple effect. Initial complications of a failing liver. The problems of cirrhosis extend far beyond the liver itself. A scarred liver cannot perform its many critical tasks effectively. This impairment sets off a cascade of health issues throughout the body. These are known as complications, and they can be very serious. Essentially, the liver's failure creates a domino effect on other organ systems. Understanding these potential complications reveals the true severity of cirrhosis. A primary complication driving many others is called portal hypertension. The portal vein brings blood from your digestive organs to the liver. In a healthy liver, this blood flows through smoothly for processing. However, scar tissue in a cirrhotic liver obstructs this normal blood flow. This blockage acts like a dam, causing blood pressure in the portal vein to rise. This increased pressure is what we call portal hypertension. It is a direct consequence of the liver's structural damage. Portal hypertension is a central problem that leads to further complications. The increased pressure from portal hypertension forces blood to find alternative routes. This can lead to the formation of swollen, fragile veins called varices. These typically develop in the esophagus and stomach and can bleed dangerously. Managing these complications is crucial for improving quality of life and survival. Section 4. When damage escalates. Severe and life-altering complications. Ascites, a severe complication, causes fluid buildup in the abdomen. It results from portal hypertension and low albumin levels. The abdomen swells, causing pain and discomfort. It can also lead to shortness of breath. Ascites increases the risk of serious infections. One such infection is spontaneous bacterial peritonitis, SBP. SBP is life-threatening and needs immediate treatment. Managing ascites involves dietary changes and medical procedures. It significantly impacts daily life and signals advanced liver disease. Esophageal varices are another dangerous consequence of portal hypertension. These are abnormally enlarged veins in the esophagus. They can rupture easily, causing life-threatening bleeding. A variceal bleed is a medical emergency. Symptoms include vomiting blood or black stools. Immediate intervention is crucial to stop the bleeding. Treatments include medications and endoscopic procedures. These can prevent variceal bleeding. The risk of variceal bleeding underscores the severity of cirrhosis. Hepatic encephalopathy, HE, is a serious brain disorder caused by liver failure. Toxins, like ammonia, reach the brain, impairing function. Symptoms range from mild confusion to severe lethargy. In advanced stages, it can lead to disorientation, tremors, and even coma. HE greatly affects daily tasks and quality of life. It can develop gradually or suddenly. Treatment focuses on reducing toxins. Cirrhosis increases the risk of liver cancer. This cancer is called hepatocellular carcinoma, HCC. Chronic inflammation and cell turnover promote cancer. Regular screening is vital for early detection. Early detection allows for better treatment outcomes. Cirrhosis weakens the immune system, increasing infection risks. Severe liver disease can lead to kidney dysfunction. This is known as hepatorenal syndrome, a serious complication. These complications highlight the need to address cirrhosis effectively. Your liver is a truly remarkable organ, performing hundreds of vital tasks every single day. It processes nutrients, filters toxins, and produces essential proteins. Healthy liver tissue is soft and pliable, allowing blood to flow through it easily. However, this hard-working organ can come under attack. Various factors, such as chronic viral infections like hepatitis C, long-term excessive alcohol use, or the buildup of fat as seen in non-alcoholic fatty liver disease, can cause persistent injury. This initial damage often occurs without any warning signs, beginning a silent journey towards more serious problems if left unaddressed. Understanding this quiet start is key. When your liver cells are repeatedly injured, they trigger an inflammatory response. Inflammation is your body's natural way of fighting off harm and initiating healing. Think of it like a fire alarm sounding when there's danger. In the short term, this response is protective and necessary for repair. However, if the source of injury continues relentlessly, the inflammation becomes chronic. This means the alarm bells are constantly ringing within your liver. This persistent state of alert signals that liver cells are under ongoing stress, a crucial early step in the development of more extensive liver damage over time. This chronic inflammation sets the stage for a process called fibrosis. Fibrosis is essentially the formation of scar tissue within the liver. As your liver tries desperately to heal itself from continuous injury, it starts to produce an excessive amount of tough, fibrous proteins, mainly collagen. These proteins are deposited in the liver, gradually replacing healthy, functioning liver cells. Unlike the original liver cells, this scar tissue cannot perform any of the liver's complex jobs. Instead, it begins to make the liver stiffer and less efficient, marking the true beginning of structural damage to this vital organ. One of the most challenging aspects of early fibrosis is its silent nature. During this initial stage of scarring, many individuals experience no noticeable symptoms at all. Your liver has a significant reserve capacity, meaning it can continue to function adequately even when some damage has occurred. This resilience, while remarkable, can mask the developing problem. However, this stage is absolutely critical. If the underlying cause of the liver injury is identified and effectively treated or removed, the process of fibrosis can sometimes be slowed, halted, or even partially reversed. This presents a crucial window of opportunity for intervention and healing. As fibrosis progresses, the accumulation of scar tissue becomes more widespread and significant. Eventually, this extensive scarring can lead to cirrhosis. Compensated cirrhosis is a critical stage where the liver has developed significant scarring, and its structure is permanently altered. However, the term compensated means that despite this damage, the liver can still perform most of its essential functions adequately enough to prevent major obvious symptoms. It is a turning point, because the liver is now officially cirrhotic, but it is still managing to cope, albeit under considerable strain. This phase requires careful monitoring. The internal architecture of the liver undergoes profound changes in compensated cirrhosis. The bands of scar tissue that have formed throughout the liver begin to surround and isolate clusters of remaining, often regenerating liver cells. This process creates abnormal nodules, disrupting the liver's normal, smooth texture. This altered structure not only impairs the function of the liver cells themselves, but also starts to obstruct the normal flow of blood through the liver. This impediment to blood flow is a key development setting the stage for future complications even if they are not yet apparent. The liver is working harder now. Many individuals with compensated cirrhosis may still feel relatively well and might not be aware of their condition. Some might experience very mild or non-specific symptoms, such as persistent fatigue, a slight decrease in appetite, or a general feeling of being unwell. These symptoms can easily be attributed to other causes, delaying diagnosis. Often, compensated cirrhosis is discovered incidentally during medical examinations or tests for other unrelated health issues. This highlights the vital importance of regular health screenings, especially for individuals who have known risk factors for liver disease, to catch it at this manageable stage. Even though major symptoms might be absent, the liver's capacity is undeniably reduced in compensated cirrhosis. Bodily functions that rely heavily on the liver may start to be subtly affected. For instance, the liver's ability to synthesize certain proteins might decline slightly. Early signs of increased pressure in the portal vein system, known as portal hypertension, can begin to develop, although it might not yet cause overt complications. The liver is essentially working on overtime to keep up with the body's demands. This compensated stage is a crucial warning period, signaling that without intervention, the condition is likely to progress to a more severe state. When cirrhosis progresses to the point where the liver can no longer perform its vital functions adequately, it enters a stage known as decompensated cirrhosis. This transition marks a serious decline in liver health and overall well-being. The extensive scarring has overwhelmed the liver's ability to compensate for the damage. As a result, symptoms become much more noticeable, more severe, and often debilitating. Decompensated cirrhosis is a clear indication that the liver is failing, and this stage is associated with a higher risk of life-threatening complications and a significantly reduced quality of life. It demands urgent medical attention. The onset of decompensated cirrhosis is characterized by the appearance of distinct and alarming symptoms. One of the most recognizable signs is jaundice, where the skin and the whites of the eyes turn yellow. This occurs because the failing liver cannot properly process bilirubin, a yellow pigment. Another common manifestation is ascites, which is the accumulation of fluid in the abdominal cavity, causing significant swelling and discomfort. Edema, or swelling in the legs and ankles, can also occur due to fluid retention and low levels of certain proteins. These symptoms are direct consequences of the liver's inability to manage fluids and waste products effectively. Specific liver functions become severely compromised in decompensated cirrhosis, leading to a cascade of problems. The liver's crucial role in detoxification falters significantly. Harmful substances such as ammonia, which are normally cleared by the liver, can build up in the bloodstream. When these toxins reach the brain, they can cause a serious condition called hepatic encephalopathy, leading to confusion, personality changes, and even coma. Furthermore, the liver's ability to produce proteins essential for blood clotting is greatly diminished. This results in an increased tendency to bruise easily and a higher risk of prolonged or spontaneous bleeding episodes. The impact of decompensated cirrhosis on an individual's quality of life is profound and often devastating. Persistent fatigue becomes overwhelming, making even simple daily tasks challenging. The physical discomfort from ascites, edema, and other symptoms can be constant. Frequent hospitalizations are often necessary to manage acute complications like infections or bleeding from varices. This stage of liver disease is life-threatening and requires intensive ongoing medical management to control symptoms, prevent further complications, and improve survival. Recognizing the signs of decompensation early is absolutely vital for timely and appropriate intervention to manage this critical condition. The liver is central to metabolism, managing glucose, fats, and proteins. Cirrhosis disrupts this process, leading to glucose intolerance, malnutrition, and muscle wasting. Specialized dietary management is crucial for patients with cirrhosis. It is crucial to understand that cirrhosis is not merely a disease confined to the liver. Its consequences ripple throughout the entire body, affecting multiple organ systems. The kidneys, for instance, are particularly vulnerable to the systemic changes caused by advanced liver disease. A serious complication known as hepatorenal syndrome can develop. This condition is characterized by progressive kidney failure in individuals with severe cirrhosis and ascites. It occurs due to complex changes in blood flow and blood vessel function that reduce blood supply to the kidneys, leading to their dysfunction. Hepatorenal syndrome is notoriously difficult to treat and carries a poor prognosis. The respiratory system can also suffer significantly due to cirrhosis. Some individuals may develop hepatopulmonary syndrome, a condition where abnormal dilation of the tiny blood vessels within the lungs impairs the transfer of oxygen into the bloodstream. This leads to low blood oxygen levels, causing symptoms like shortness of breath, especially when upright, and fatigue. Another less common lung complication is portopulmonary hypertension. This involves high blood pressure in the arteries that supply blood to the lungs, putting a strain on the right side of the heart and further compromising respiratory function. Both conditions add considerable burden to the patient. The cardiovascular system is not spared from the effects of advanced liver disease. Cirrhotic cardiomyopathy is a condition where the heart's structure and function are altered. While the heart may actually pump out more blood per minute, its ability to respond to stress can be impaired, and its contractions may be weaker. Patients with cirrhosis often exhibit a unique circulatory pattern characterized by low systemic blood pressure and dilated blood vessels throughout the body. These hemodynamic changes can further complicate the management of cirrhosis and place additional strain on an already struggling system, impacting overall stability. Furthermore, cirrhosis significantly weakens the body's immune system, rendering individuals much more susceptible to a wide range of infections. The liver plays a critical role in filtering bacteria and other pathogens from the blood that enters from the intestines. When liver function is compromised by scarring, this protective mechanism is less effective. As a result, bacterial infections are a common and serious complication. Spontaneous bacterial peritonitis, an infection of the acidic fluid in the abdomen, is a prime and often life-threatening example. These infections can trigger further deterioration of liver function and other complications, highlighting the systemic vulnerability. End-stage liver disease, often referred to as ESLD, represents the most advanced and severe phase of cirrhosis. At this point, the liver has undergone such extensive scarring and damage that its ability to perform its essential functions is critically compromised. Life-threatening complications, such as recurrent variceal bleeding, intractable ascites, severe hepatic encephalopathy, and kidney failure, become increasingly frequent and difficult to manage effectively. The body is under immense strain, and overall, health is profoundly impaired. This stage signifies that the liver is approaching complete failure, and options become more limited without definitive intervention. Healthcare professionals use specific scoring systems to objectively assess the severity of end-stage liver disease and to predict the short-term risk of mortality. The model for end-stage liver disease, or MELD score, is one such widely used tool. It incorporates laboratory values like bilirubin, creatinine, and the International Normalized Ratio, a measure of blood clotting. A higher MELD score indicates more severe liver dysfunction and a greater urgency for intervention. These scores play a crucial role in guiding critical treatment decisions, including the prioritization of patients on the waiting list for a liver transplant. For many eligible patients battling end-stage liver disease, a liver transplant offers the most significant hope for long-term survival and an improved quality of life. This major surgical procedure involves replacing the diseased, failing liver with a healthy liver from a deceased or, in some cases, a living donor. While transplantation can be life-saving, it is a complex journey fraught with challenges. These include the scarcity of donor organs, the risks associated with major surgery, and the lifelong need for immunosuppressive medications to prevent organ rejection. However, for successful recipients, it can mean a return to a more active and fulfilling life. Regardless of transplant eligibility, comprehensive and compassionate care is paramount for individuals navigating the final stages of liver disease. Palliative care, which focuses on relieving symptoms, managing pain, and addressing emotional, social, and spiritual needs, can significantly improve quality of life. This specialized care supports both patients and their families through this difficult time. It is important to remember that while end-stage liver disease is a grave condition, medical advancements continue to offer new strategies for management and support. Ultimately, the best path forward always involves prioritizing prevention and early detection to avoid reaching this advanced stage whenever possible. Cirrhosis profoundly impacts life quality, extending beyond physical symptoms. Imagine waking up exhausted, a fatigue that no rest alleviates. Simple tasks feel monumental, and chronic fatigue chips away at energy. Cognitive function can also be impaired, leading to brain fog. Dietary restrictions become burdensome, stripping joy from meals. Social and emotional well-being are significantly impacted. Understanding cirrhosis is about the entire person and their experience. Decompensation marks a critical turning point in cirrhosis, where the liver's ability to cope fails. This shift from compensated to decompensated cirrhosis signals severe liver dysfunction. Symptoms like jaundice and ascites become more severe, indicating liver failure. This stage often requires intensive medical interventions and highlights the need for specialized care. Early detection of cirrhosis is crucial. It allows for timely intervention, slowing or halting disease progression. Regular checkups and screenings are vital, especially for those at risk. Early action can prevent severe complications, offering a more hopeful outlook. Cirrhosis deeply impacts psychological and social aspects of life, creating hidden burdens. Anxiety, fear, and depression are common emotional responses. Constant medical monitoring creates persistent stress. Emotional struggles significantly impact quality of life. Social stigma and misconceptions add to the burden. Stigma leads to shame and social withdrawal. Isolation worsens loneliness and depression. Compassionate understanding is crucial for support. Cirrhosis strains personal relationships and family dynamics. Caregiving roles are emotionally and physically taxing. Reduced participation in activities shifts family dynamics. Open communication and support are essential. Holistic care addresses relational aspects. Financial strain is a significant issue. Medical costs and job loss impact income. Navigating financial assistance adds stress. Financial worries affect well-being. Addressing socioeconomic factors is crucial for comprehensive care. Understanding cirrhosis, from its silent beginnings to severe complications, reveals that knowledge is profound power. Recognizing risk factors like hepatitis, alcohol, and obesity empowers proactive steps. Early intervention and informed action shift the narrative to hope. Knowledge fosters a proactive stance, reducing severe consequences. Cirrhosis of the liver is a serious condition, marking advanced liver damage. Healthy liver tissue is replaced by non-functional scar tissue over time. This process, known as fibrosis, unfolds over months or years. Long-term harm compromises the liver's vital functions. Understanding this progression is crucial for protecting your health. Awareness and early detection can make a monumental difference. Understanding the roots and repercussions. Pathways to prevention and management. Cirrhosis stems from various causes, not just alcohol abuse. Chronic viral hepatitis, obesity, diabetes, autoimmune diseases, and genetic conditions are significant contributors. Understanding these risks helps in prevention and proactive management. Early intervention and healthy lifestyle choices are crucial. Seek timely medical advice and screenings if at risk. Section 3. Empowered by awareness. The critical role of early action for liver wellness. Early detection of liver disease dramatically improves outcomes and saves lives. Identifying liver damage early allows for effective intervention. Treatments and lifestyle changes can slow or reverse liver damage. Late-stage cirrhosis has limited treatment options. Early intervention can preserve liver function for years. Cirrhosis affects quality of life. Chronic fatigue can be debilitating. Cognitive issues erode mental clarity. Dietary restrictions can be challenging. Emotional well-being often suffers. Preventing advanced cirrhosis is crucial for vitality. Knowledge about liver health is empowering. Understanding transforms individuals into active health guardians. Regular screening is a proactive health step. This reduces anxiety and promotes timely consultation. Collaboration with your medical team is key. This partnership achieves better long-term health outcomes. Awareness and proactive steps can make a tremendous difference. We can significantly reduce the burden of advanced liver disease. Promote healthier lifestyles and early detection. Better liver health is an attainable goal. Embrace this knowledge and protect your future well-being. Share your story in the comments below. Your perspective is incredibly valuable. Personal narratives foster connection, offer comfort, and reduce isolation. Your insights are more powerful than you might imagine. Let's build a compassionate community together. Continue your journey to liver wellness. Explore further information and stay informed. Knowledge empowers you to make the best decisions for your well-being. Delve into resources dedicated to liver health. Share your story and expand your knowledge. Invest in your liver health today for a healthier tomorrow.